Good afternoon, everybody. Um, the computer issues that we have in our classroom have not changed from the first part of the semester. So we have technology on top of technology. What could go wrong, right? So we're going to pick up with the facial bones. I'm going to record these in increments of 8 minutes or less so that we can caption them. But anyway, we're going to have a test on facial bones next week. If this seems a little bit awkward to you, it's much more so to me. I've never done a lecture that I didn't have a class in front of me. So just bear with me, and hopefully this will get better by the time we meet back up in class. So the anatomy of the facial bones, we've got 14 facial bones total. We've got 2 nasal bones. There are some questions on this test about the nasal bones, even though the nasal bones are listed in the next section as being testable. So you've got 2 nasal bones being the bones that stick out of front. These 2 right here being the nasal bones. You got lacrimal bones right there where the lacrimal glands are. That's where your tear ducts are. So you got lacrimal bones, and both of those bones are very, very thin and easily fractured. Then you got the maxilla, which is the largest bone in the facial bones. That's these bones here. You got the zygoma. The zygoma are your cheekbones here. So you got the zygoma. The zygomatic process reaches back and grabs onto the zygomatic arch from the temporal bone to create your zygomatic arch and the rest of your cheek. You got the palatine bones, which are inside, and if you'll notice, most of what makes up your hard palate is not the palatine bone, but rather the maxilla. So the palatine bone forms about the posterior most third of, or even a quarter of the bony hard palate here. On the inside of the nose, we talked about these earlier in the semester, the turbinates. The turbinates being the scroll bones that are inside of the nose that are covered with mucosal lining so that air is warm before it gets down into the lungs to hopefully keep your temperature up, maintain homeostasis. The vomer is continuous with the nasal septum, and then the mandible, where's my mandible? Is of course the jawbone, and we'll talk about the mandible in its own section as well. So, picture of the facial bones there. Again, we've got the nasal bones, then we've got the lacrimal bones, then we've got the maxilla. On the inside, we've got the turbinates, and we've got the vomer, that's the nasal septum there, superior orbital fissure, which really doesn't have any play here, it's just labeled. We've got the zygoma, and then the mandible. So you got 2 of most everything. You've only got one maxillary bone, but they're fused right in the middle, and they come together pretty much at the inferior, or at the acanthion, rather, inferior portion of the nose. So the nasal bone is very thin, and some of your textbooks will list the nasal bones as the most commonly fractured, and probably the most commonly fractured of the facial bones, just because of their location, the mandible being the second one behind that. By virtue of the thinness of the bone, the nasal bone is very easy to break, but they're probably not as thin as the lacrimal bones, which are very, very easy to fracture as well, just because of how thin they are, but they're not right out in front of the patient, kind of, something easy for the airbag to hit. So nasal bone is most common, mandible second most common, the lacrimal bone is probably most fragile. There's 2 of them. They're fused together in the middle. There's one on the left, one on the right. They vary in size and shape in individuals. They form the superior bony wall of the nasal cavity, and that is the bridge of the nose. they form the bridge of the nose. They articulate with each other at midline, so they got a suture that holds the two together. The superiormost portion, they articulate with the frontal bone. They do articulate posteriorly with the ethmoid bone, and on each side they articulate, if only a little bit, with the maxilla. So they're really kind of sticking out there all by themselves a little bit. So the lacrimal bones are the two smallest bones in the skull. Again, they would be even more easily fractured than the nasal bones were it not for the position inside the orbit. So located on the anterior portion of the medial wall of the orbits between the labyrinth of the ethmoid bone, those being the ethmoid air cells, and the maxilla. Each bone contains a duct for the tear duct, a lacrimal foramen. And it's got a lot of articulations as well. So it articulates with the frontal bone, the ethmoid bone more posteriorly, the maxilla, and also with the turbinates. The maxillary bones are fused together at midline, and they're the largest immovable bones of the face. Each articulates with all the other facial bones with the exception of the mandible. The mandible articulates with the temporal bone at the TMJ. So it also articulates with some of the cranial bones, frontal bone, and ethmoid bones. They form a part of the lateral wall and most of the floor of the nasal cavity. And they form a part of the floor of the orbit, and we have some specific fractures that we'll talk about here in a little while that are technically fractures of the orbit, and we'll talk about the mechanism of those and how to diagnose those. So maxillary bones form 3/4 of the roof of the mouth. Again, the palatine bones form the other fourth. They have a zygomatic process that articulates with the zygoma to form part of the cheekbone. The body contains the maxillary sinuses, which are pyramidical in shape with a point to the bottom. So we've got a lot of different names for the maxillary sinus. It's the antra of Highmore, the maxillary sinuses, obviously. There's another one I'll think about here in a bit. So the infraorbital foramen, infraorbital being below the orbit, the foramen being a hole, and that's just a nutrient foramen for the nerve and artery to pass through. That's that hole right at the bottom of the orbit, right there. All right, so the alveolar processes, you've got alveolar processes in both the mandible and the maxillary bone, and that is just where the teeth sit. You've got the anterior nasal spine, which is really your canthion, and that's where the two bones come together and they kind of push forward. Zygomatic bones form prominence of the cheek, that is your cheekbone. Forms a part of the wall, the side wall and the floor of the orbits. We talked about the temporal process extending posteriorly to create the rest of the cheekbone with the zygomatic process of the temporal bone. I think there is a test question that refers to the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. So don't confuse those two. The temporal process is on the zygomatic bone. The zygomatic process is on the temporal bone. And the zygomatic arch is formed by all that. So articulations of the zygomatic bones would be superior. You got frontal bone at the superior articulation. Lateral articulation, again, you've got the zygomatic process of the temporal bone. Anteriorly, it articulates with maxilla, and posteriorly with the sphenoid bone. So laterally, your facial bones look like that.